when women lose pregnancy in the first 3 months or another 3 or 4 months after, that is first trimester or second trimester, that is called miscarriage. When it happens in the early first trimester, it is called early or first trimester miscarriage. This is due to different causes, whereas the miscarriage which happens later are due to different causes. Therefore, it's better to classify miscarriage into early and late miscarriages. Yes, we have had quite a few patients who have come with a history of 8 or 9 miscarriages, and we have done all the tests and found out the cause and treated them, and they ended up having live babies at the end of the treatment, which gives hope to a lot of couples. Now we are going to talk about early miscarriages, and most of the early miscarriages are due to chromosomal issues in the fetus or baby. That is the commonest cause. But if we analyze the different factors causing the miscarriage, I would say the issue could be with the embryo, or the issue could be with the implantation and the environment, that is the uterine environment. These are the 3 things which can cause problems. So we have to look at the factors with embryo, factors with the uterus, and also factors interfering with implantation. First of all, we need to do the investigations to find out what is causing the problem. And as far as the embryo issue is concerned, it may be due to chromosomal abnormality, in which case I advise both the partners to have a blood test to check their chromosomes first, to see if there is any minor chromosomal abnormalities such as deletion, translocation, and balanced or unbalanced translocation. This is what we will check. But even if these are normal, they could still have chromosomal abnormalities in the embryos due to the quality of the egg and quality of the sperm, and in advanced maternal age, this is common. In such cases, the main thing is we have to do IVF treatment and make embryos or create embryos and test the embryos. This is the most important point. What are we testing for? Testing for the embryo normality. The embryos contain all normal chromosomes. If they have abnormal chromosomes, then they are having an abnormality, such as Down syndrome baby, where there is an extra chromosome in 21 chromosome. Similarly, if there is one chromosome less in another chromosome, then it will also be a problem. So these are the things they are checking in with the embryo. And if we transfer chromosomally normal embryo, then the woman is likely to get pregnant with a healthy baby and not miscarry. So this is part of the embryo issue I told you. But next we come to the uterus, uterine environment, and the implantation issue. So if there is anything to do with uterine abnormality like uterine septum or scar tissue in the uterus. This can interfere with the implantation. That is why after repeated miscarriages, we recommend hysteroscopy, having a look inside the uterine cavity with the camera to see if there is any polyp, scar tissue, or any fibroid or abnormalities of the uterus, such as septum or bicarbonate uterus. All these things can lead to a higher risk of miscarriage. And if we find something, we can treat it at the same time. So this is important to correct the uterine environment. So this another issue with the uterus is infection of the uterus. Everybody is talking about it recently. This is called uterine microbiome. And there are tests called Emma and Alice, girl's name, which is easy to remember for anybody. We take a biopsy from the uterine endometrium, send it to the lab. They do DNA studies and see if the uterus has got pathogenic bacteria. Uterus is supposed to have 90% lactobacillus. Lactobacillus is the good bacteria which helps with the implantation. If the lactobacillus is less than 90%, then the implantation rate will be lower. Especially if somebody has got pathogenic bacteria, that means bacteria that are harmful, then the concentration of the lactobacillus will go down. By doing this Emma and Alice test, we will know whether such a thing is happening in the uterus. Then we can treat the infection or the pathogenic bacteria with appropriate antibiotics and clear the infection, followed by probiotic treatment vaginally. Therefore, we give lactobacillus to increase the concentration of the lactobacillus in the vagina and uterus, which will improve the implantation and reduce the risk of miscarriage. So this is as far as the uterine environment. One is structural abnormality, other one is infection. Another The third one is what is called immune factors. There are certain immune issues which could interfere with the implantation, such as antibodies, natural killer cells, and toxins produced by natural killer cells, and also some thrombotic issues. These are called clotting issues, which lead to clot formation in the placenta and obstruct the blood supply to the baby, thereby baby dies, that is leading to miscarriage. So all these immune causes, they again interfere with the blood supply or directly attack the embryos, thereby causing miscarriage or failure of implantation. These have to be treated depending on what type of immune issue is present in the particular woman, and then if they try for a pregnancy, or they can even have IVF with tested embryo, in which case they are likely to have the healthy baby. So I said, I made it very simple, but at the same time very educational. These are the main points everybody should understand. We should check for all these things, and then we treat all of them. Then we have had so many patients, like I said, 8 or 9 miscarriages I have seen. And when they come back with the baby, they say, "This is a miracle baby, doctor." It's so wonderful to hear that. I tell them, look, I haven't done any miracle. I went scientifically, did everything, and you got your little girl. So that is wonderful. You know, it's such a lovely feeling. And for them, it is like a dream come true and, you know, like a miracle, because especially if someone has undergone 8 or 9 miscarriages, it is so awful, it is so traumatic, and I think they need support. There are some societies which can, miscarriage associations which can give support. In the Holly Street Fertility Clinic, we have in-house counselors to give them support. We also have acupuncture to reduce the stress so that they can have positive mentality to go through the treatment or get pregnant, because such women are so frightened of getting pregnant and losing another pregnancy. So we have a holistic approach, and we have good support system in holistic fertility clinic to help such women go through another pregnancy which will end with a healthy baby.